Hi, myself Dr.Hardik. I am an orthopedic surgeon in Wokat Hospital, Rajkot. Today we'll be discussing a case of shoulder rotator cuff tear and we'll be repairing it arthroscopically. So without wasting time, let's just dive into the shoulder joint. Switch to the operating room. So as you enter into the shoulder joint, you can see here the glenoid, the humerus head, the superior labrum, anterior labrum, posterior labrum. As you enter deep, you can see the biceps tendon origin. There it is. This is the biceps tendon in front of you. Now as you move further, you can see that sinus structure there. It's a subscapularis tendon. It's intact. Now we have to remove the soft tissue muscles for clear vision so that you can see the cuff clearly. So we have to release soft tissues. We have to do subacromial decompression to make sure while using the RF that it don't bleed, and if it's bleed you quickly coagulate it so that your operating field remains clear. This is subacromial decompression. Remove all the synovial tissue which can be the reason of painful shoulder joint. This is the cuff, white color shiny structure which you are seeing is the cuff, and now we have proper vision. This is the retractable cuff. As you can see this, we are retracting the cuff to its original position. Now we are putting the suture anchor. Make sure you place it correctly in a correct direction at the bone and cartilage junction. That is the cuff in front of you. So now we have taken the bites through the cuff, and you can see this cuff getting retracted, and we are bringing it back to its original position, and we'll tie a suture knots there. Thank you very much. Thank you.